assessment and presentation untuk pelatih-pelatih post basic formasi bawah topik ataupun bawah subjek PFCD 1112. So hari ini kita akan dengarkan presentation daripada para pelatih. So bersama saya dalam presentation ini adalah beberapa rakan pengajar sebagai examiner untuk pagi ini, iaitu Encik Aizat. Encik Aizat. Okay, apa khabar? Assalamualaikum Encik Aizat. How are you?
Waalaikumsalam. I'm very fine. Thank you for the invitation. Thank you, Puan.
Right, and the second one is Puan Azlina binti Abdul Karim.
Assalamualaikum. Selamat pagi. Selamat pagi Puan Mazdila. Terima kasih. Pagi.
Okay, right. And last but not least is our pelatih for this morning, Mr. Derick Victor. Hello, morning, Derick.
Morning. Hello.
How are you today?
I'm fine.
Right. Okay, so don't be nervous. You just present as a presentation. No need to worry. So without any excuses or anything, we will go to your presentation. So good luck, Derick.
Okay. Okay, good morning to Mr. Aizat, Puan Azlina, and also to Puan Masdila. So today I'm going to present to you about my assignment, this occupational safety and health administration. Okay, let us go for handling first. Handling of hazardous engine. This is for chemical part. Okay, first of all, what is chemical? By definition, chemical is any substance consisting of matter that includes solid, liquid, and also the gas. So it can be pure substance or mixture of substance, and it can be in the form of gases, vapor, solid, fiber, liquids, dust, mist, and also fumes. So a little bit info about chemical that I choose, that is benzene. Info about benzene. It is first extracted from coal gas by oil scrubbing in 1860 by the Badish company in Germany. It has colorless and or light yellow liquid at the room temperature. Also has sweet odor. It is highly flammable, and it evaporates into the air very quickly. And the vapor itself is very heavier than the air, and it may sink into the low-lying areas. So this benzene dissolves only slightly in water, and it will float on top of the water. Benzene is chemical with specific OSHA regulation. So OSU Chemical Safety Committee has classified this benzene as a high hazard carcinogen. So any usage of this chemical must be registered and also controlled. Okay, for monitoring, this benzene is used outside the approved laboratory fume hood. The environmental health and safety should be contacted to perform this air sampling. So the PEL or permissible exposure level for benzene is 1 ppm average over an 8-hour workday. In some research, this PEL for benzene is recorded more than 100 ppm lah. So the additional precaution must be taken if this benzene level exceed the PEL itself. So user may be monitor their own benzene exposure after consulting with the environmental health and safety by using the one devices, which is the benzene monitoring devices. And the result of this benzene monitoring must be documented, including the dates, number, and also the result of the testing, methods used in testing and taking samples, description of the type of any respirator that has been worn or specified in handling the benzene, name and the social security number of the people who exposed. The monitoring documentation must be kept on the file for at least 30 years, and the department responsible for using this benzene must show the written result of all benzene that testing to all affected workers. And the notification must be made within 15 working days after receiving the result, and must include action to reduce the benzene level if the permissible exposure level has been exceeded. So all the employees who work with the benzene has the right to observe their testing procedure. So about training, so anyone or any personnel who working with this benzene, they must be given information and training how to use the chemical safety lah. For example, analyze or reading the SDS first and reviewing the and understanding this safety instruction, then we'll meet the minimum benzene training requirement. And any additional information about benzene is available from environmental health and safety and other resources. Okay, we have come to personal protective equipment. So first of all, this all may be an illustrative purposes only. First of all, I would like to present about this respirator. Okay, respirator here are required where the laboratory fume hoods or other exhaust system cannot be used. So respirator must be approved for use with the benzene and properly fitted, and cartridges must be replaced before their service life end. And the wearers must be trained in use and understanding this limitation before using any respirator. And the canister itself, the benzene canister, usually brown color cartridges, and it is in the class of PA1, PA2, or PA3. The next one is protective clothing. Any personnel handling this kind of chemical must be wearing appropriate protective clothing such as rubber boots, gloves, sleeves, apron, and etc. For any part of the body that could be exposed to liquid benzene, because any exposure through contact with skin could lead to acute or chronic disease lah. Okay, the next one is eye and face protection. Any personnel must be wear splash-proof safety goggles if it's possible that benzene may get into your eyes. Any additional things, item that a person should be wearing is the face shield lah, to if the face could be splashed with the benzene liquid. Okay, for spills and disposal procedure, usually contact environmental health and safety for assistance in dealing with all the benzene spill of more than 500 ml. Okay, this small spill should be immediately cleaned up using an appropriate absorbent. For a larger spill, such as spillage of benzene from the tank, can be cleaned up using sand lah. Waste material should be contained and disposed of through the hazardous waste disposal program, and benzene must not be poured down the sewer system lah. Precaution for safe use, handling and storage. The benzene liquid is highly flammable and should be stored in tightly closed container in cool ventilated area. Fire extinguisher where provided must be readily available, and every workers or personnel must be know where they are located and how to operate them. And this benzene vapor may be in the form of can form explosive mixture in the air. So all sources of ignition must be controlled and only use non-sparking tool when opening or closing benzene containers, and it can be only transferred with grounded non-sparking equipment. Transfer of benzene must be done in the well-ventilated area lah. So the smoking is totally prohibited in areas where the benzene is used to store. Usually the supervisor, any question can be asked through the supervisor lah, where the benzene is used or any additional plant safety rules. For emergency and first aid procedure, if it's splash in the eye, wash out immediately with large amount of water for about 15 minutes. If the eye is still irritated, seek for medical attention lah. If it's still on body, take off all the contaminated clothing, thoroughly wash all contacted skin with soap and water. Wash contaminated clothes before wearing them again. Okay, if a person inhaled large amounts, quickly get the exposed person to fresh air quickly. Apply artificial respiration if the person has stopped breathing, and always call for medical assistance. If a person swallowed, do not induce vomiting because it can be cause more dangerous. Uh, and then seek for medical assistance. Okay, the signs and label. Every warning sign must be posted at entrance to areas where the exposure to benzene might be reasonably be expected to exceed the PL. So the sign must be following the danger, benzene, cancer hazard, flammable, no smoking, authorized personnel only, and also respirator required. So all benzene containers could be labeled with danger, benzene, flammable, inhalation, and cancer hazard. For example, in this picture, we can see the flammable here. Okay, for a medical surveillance program must be established for those people who work regularly with benzene at or above the PEL. Contact environmental health and safety for specific benzene levels and program procedure. Okay, for demo video, I will show you.
Well, for starters, areas where benzene is routinely present will be posted with signs to let you know of the hazard. You can find benzene in refinery units where it's made or used, during barge, tank, rail, and truck loading and unloading operations, in pipelines, in crude oil and condensate for some of our production operations, as well as in mixtures of other chemicals. Any containers you handle that contain benzene in concentrations which could lead to overexposure will be labeled according to government regulations. Pure benzene is a clear, colorless liquid with a pleasant, sweet odor. And odor is important when working around benzene.
Well, what could be bad about something that smells good?
Well, quite a few things, Jeff. And you can't really trust your nose for protection, because if you can smell it, the airborne concentration has already reached levels which are higher than permitted. So the best protection is know where benzene might be present before you start to work. People in the lab must use a back bulb, fill a portion of the fluid, instead of using the mouth to suction benzene. This way, you'll avoid ingestion. When benzene comes in contact with the skin, it can be absorbed into the bloodstream and cause dizziness and loss of balance. These are short-term or acute effects. If your skin comes into repeated contact with benzene, it can dry out the natural protective oils in the skin, leading to dermatitis. Dermatitis occurs after repeated or chronic skin exposures. If benzene is splashed into the eyes, it'll sting and result in tearing and irritation. The most serious health problems known to be associated with benzene overexposure have been the result of inhaling benzene vapors. Acute overexposure to benzene may make you feel lightheaded, giddy, dizzy, and you may feel irritation in your eyes, nose, and throat. Severe overexposure can lead to a loss of consciousness and even death. Chronic overexposure may result in various blood disorders, ranging from anemia to leukemia. While engineering controls are being implemented, when repairs or maintenance are necessary, in emergencies, or when benzene is used less than 30 days a year, you may need to wear a respirator.
That's why I had the lung test.
You got it. To wear a respirator, you need medical's approval. Then you'll be fitted with a respirator, and the fit will be tested. The respirator will be equipped with special cartridges designed for benzene or organic vapors. The respirator cartridges should be replaced at the beginning of each shift and discarded at the end of the shift.
Yeah.
Bukan
Apa tuh? Ya.
So sudah copyright kat situ dah ada masalah kalau kita present kat sini secara live. So that's why I suruh you stop. Okay, tak apa.
Okay.
Just you boleh mungkin briefly je apa yang stop the video. Just briefly je bagi tahu saya Puan dengan Encik Aizat apa yang you contain dalam video tu aja. Okay. Not only the purpose of the copyright tu yang menyebabkan saya suruh stop. Bukan sebab apa. Okay.
Alright. Alright. Okay. This demo this demo video is all about what I have been presented lah from the earlier. So what is benzene is, what the
Please proceed with the presentation, sir.
okay. Okay, for manual handling, the environmental condition. Okay, this is the poster that I made. This is more generally, for example, the extreme temperature called, I choose fireman deal with fire in the solution where the proper garment, because this garment is a heat insulator lah. So the effect of the next one is the effect of lighting toward the eye. If working with BSC too long, so the solution is where stable spec that have transition properties. Hearing loss and temporary threshold shift for wood cutting, wear ear protectors such as earmuff or other than wood cutting, it can also be seen at the airport workers lah. So for the health risk assessment, the safety data sheet that I choose is cisplatin. Okay, the first one is the identification of the substance or preparation and the company or undertaking. Okay, the company name all have been here, emergency number phone, the supplier and so on. And the material names is platin solution 0.5 and 1 mg mil. The brand name is platinol, the chemical family, intent for use as what, and in this case the cisplatin is NTD plastic. Okay, the composition and the or information of the ingredient itself for the hazardous thing. In this table, the ingredients are here, and the CAS number also stated. The CAS number is the unique identifier to identify the chemical itself. So the next one is EU ANEC list. This is all 7-digit. Is for regulatory purposes lah within the European Union. Okay, the hazard identification, the appearance, clear light to light yellow solution, the signal word warning, statement of hazard, possible carcinogen, known clinical effects, effect on blood and blood forming organs, European indication of danger, mutagenic category 2, carcinogenic category 2, and the other additional hazard information lah, such as short for acute, may cause eye, fatal, for the long-term or chronic exposure for repeat dose studies in animal. It all been shown in here lah. So the sign of the toxic is here. The phrases and the additional note has been it's been there lah in the SDS itself. So for the first aid measures, it also contained here. For example, eye contact, immediately flush eye with the water for at least 15 minutes, skin contact, injection, and the firefighting measures is also stated in here. For example, extinguishing media, use carbon dioxide, dry chemical, hazardous combustion products, formation of the toxic gases possible, firefighting procedures. When all the firefighting activities, please wear the appropriate PPE or if any fire explosion hazards, it is not applicable in here. Okay, the accidental measure, the health and safety precaution, personnel involved in cleanup should be wearing appropriate personnel PPE to minimize the exposure. For cleaning and collecting, contain the spill. For the measure of environmental protection, please place all the waste properly. And for the additional consideration for large spill is for non-essential personnel only should be evacuated from the affected area, and then report should be done. And for storage and handling, general handling, eliminate possible ignition sources like heat, spark flame, impact, friction, electricity, and so on. avoiding contact with the eye, skin, and clothing, and also avoid certain things like breathing vapor or mist, and use the adequate ventilation. Okay, the storage condition, store at the control room temperature. Should be protected from light. And in the SDS also is stated like transportation and so on lah. So the SDS for this cisplatin only sampai sini saja lah. Okay, next one is HIRARC. Okay, this HIRARC form, the company, I choose company XYZ, and the process or location is the Pfizer Pharmaceutical Group, and it was approved by, I put the name Aman and the pegawai, and the date, yeah, and conducted by who? Is Mix X and Mr. V on was 2 seconds lah. Okay, for the hazard identification, in here we must identify the hazard lah. So I put here the work only one. The work activity number one is to transfer cisplatin to drip, and the hazard itself is spillage lah. And sometimes spillage can be when transferring cisplatin to drip. Sometimes can be occur when the cisplatin itself flowing through needle. So it can, which can cause or affect, it may cause skin contact or cancer. So for the risk analysis, the risk is analyzed. So existing risk control, if any, follow SOP or guideline. So the likelihood I put 2, because the more higher, more low risk lah. So the severity I put 2. The risk I put here 16, which is high. And for the risk control, how to prevent is the recommended control measure is to practice aseptic technique. And PIC is for due date or status. I put here Ali completed this task by 31st December on 2019. And I think that's all from me lah. Thank you.
All right, thank you, Mr. Derick. Okay, without any delay, I think let me be the first one to comment, Mr. Aizat. Is it okay? Just a little bit one. Can you show back to us regarding your HIRARC form? Okay. Looking for the work activities, that is to transfer, what is it? Transfer, is it? I can see.
Transfer cisplatin.
Cisplatin, okay. So the hazard is spillage, and which can cause skin contact, and risk analysis. What do you understand regarding the likelihood and severity and risk?
For the likelihood and severity, the higher the number, the more low risk is there lah. If more low the number.
Okay, right. So what is actually the relationship between the likelihood, severity, and risk? Why the risk you get 16 over there? Can you explain to me?
The risk is because the risk here, the higher the number, the higher the risk lah.
Okay, so why you get the 16? How you get the 16? From where? Is it from the timetable? Is it because of your after you do the observation, you put the 16, or what do you understand about the risk?
It comes from my own observation lah.
Your own observation.
Yeah.
All right. Do you know how to get the risk, Mr. Derick?
Not sure.
Okay, actually, risk tu you dapat adalah bila you darabkan likelihood dengan severity.
Oh ya. Okay.
So how can 2 times 2 is 16? Supposedly it's just risk 4. It's the
Okay.
lowest one.
Okay. Okay.
Kan?
Okay.
So ni mungkin you please read more regarding the HIRARC HIRARC forms and how to find the risk when you do the observation for the works activities, and the rest I pass to my examiner lah. Mr. I go to Puan Azlina first.
Thank you, Puan Masdila. Hi, Derick.
Hello, Wan.
Hello, Puan Azlina, are you there? Puan Azlina, are you there?
Problem with the connection, I think. It's freezing there.
Okay.
Okay.
Or maybe we go to Mr. Izzat.
Okay, first of all, I would like to congratulate Mr. Derick for your daring attempt towards this presentation and this final makeup of the introduction about the benzene exposure. The explanations are quite well. I believe you read a lot of materials with regard to this thing lah. Okay, tu Puan Azlina dah ada. Never mind. We go back to Puan Azlina first. Ya, silakan Puan Azlina.
Okay, proceed Puan Azlina, you mute.
Sorry. Derick,
Yeah.
anything you'd like to say regarding your pictogram for the SDS?
Pictogram.
Is it the new one or the old one? Is it the version new one or the old one? You still remember the class? Background should be what color?
White and black.
White kan? Tepi dia merah
Yeah.
kan? So that was the old version. So supposedly you have to change it. Okay.
Okay.
And the rest yang lain very good. Your slide, okay, full of information, and then fulfill the requirement content. Okay. So far itu sajalah dari saya. So nice presentation. Back to you, Puan Masdila.
Alright, thank you Puan Azlina. And last but not least, our last examiner is Mr. Izzat.
Okay, I got two questions only. So the first one, the HIRARC form actually being used for this chemical exposure, but I can see that your chemical exposure is not complete because this is a process in the chemistry lab, right? So by right, it is a sequence of the process, but I'm not sure why you just indicate here as a transfer of cisplatin. It's different with the presentation, and then it's different also with the submission. Memang awak ada buat perubahan
Yes.
Okay, so never mind. So based on this, you indicate here as a transfer cisplatin to the drip. It's okay to take it as a HIRARC. My question will be, you should analyze it by the process, you see, because beside the transfer, there is another risk involved. For example, manipulation and also some sort of preparing the drugs. Do you need to dilute this cisplatin, or you can just directly use based on the specific concentration? What do you think, Mr. Derick?
This cisplatin can be used terus guna.
So this one is already diluted, can be direct administered to the patient.
Yeah, this is a solution form.
It is a solution form, and then okay, if you talk about the risk exposure and so on, you must also indicate what is the likelihood because of the number 2 there. Why you give number 2? Why you give number 2 for the severity? Why you give the number 2 for the likelihood? But I believe that is already being asked by Puan Mazdila before this lah. It's just by right for your information and also the other viewer. If you're doing some sort of HIRARC assessment, you must took into consideration of the process. So the process must be a complete process of a certain procedure. So this one is actually the administering drug from the competent personnel to the patient. So that is a procedure, there is a process. So the process also should end up with the disposal of this particular vial, betul tak? Dia takkan transfer cisplatin lepas tu dia pergi buang kat dalam bilik air, tak? There is some sort of also other risk lah, but of course it's not significant. So that is the first question. So another question or another improvement that you should also take into consideration is your poster. You poster tadi you buat pasal apa?
General tadi.
You buat pasal environmental condition, right? So I think this one need to be improved lah, because the environmental conditions that you are trying to measure or you're trying to make a poster is what kind of environmental condition that you want to talk about. If you are focusing on the cold temperature or in the are you trying to talk about the noise? Are you talking about to talk about the ergonomics? Are you talking about the lighting? If you're talking about the lighting over there, effects of the lighting towards the eye, maybe you want to see is there any sort of the eye fatigue symptom, fatigue, or any stressor that can lead to this poor environmental condition. You should make one poster with regard to that. No need to talk everything, because if you talk everything, you don't have a focus, like this example. Okay, so I really hope that your poster need to be improved, and then you need to choose lah. Okay, your preference, which hazard that you are, what kind of environmental condition that you plan to explain actually, if you can share with us.
If I given a choice, I will choose the extreme temperature lah.
Extreme temperature based, because there is classification kan, setiap student have the ability to choose whether they want to do the biological, chemical, something like that, and then you choose, you are being chosen for the environmental condition, and under environmental condition you want to focus on the extreme temperature. That's very good. So if you are focusing on the environmental condition, extreme temperature, focusing on extreme temperature, what kind of extreme temperature that you are talking about? You are talking about the cold or heat? Which one that you prefer, for example?
For example, I will choose the hot lah.
Okay, you choose the hot. Then what is the possible work unit that we are going to be impacted by this hazard?
For the work, for example, here the fireman lah.
Fireman.
Fireman,
Fireman is far away actually from your clinic. The easier way is actually finding someone near to your workspaces. For example, a cooker, something like that lah. You just to think about the whatever available near to your facilities, that then easily for you to imagine what kind of hazard involved, how this hazard can be impacted to their life, and then what kind of health risk that they will be possessed. So that kind of explanation or the graphical informations you need to be shared. Okay, so nanti awak buat lah, boleh ke?
Okay, boleh.
Okay, heat stress ni generally speaking, for the benefit of the reader and viewer outside there, you must consider two things when you talk about the heat stress. The first one is actually a BMR, basal metabolic rate. It's all about the people who are working with that sort of mechanism. Contoh dia, awak kata tadi fireman ke, saya kata tadi memasak kan. There are some movement with regard to these activities, and that movement is actually generating heat. So that is called body heat lah. Even you are trying to respirate pun, you akan menghasilkan heat haba kan. And then you are also need to consider the other things lah. For example, dia punya climatic condition, adakah dia exposed to the sunlight, non-sunlight, indoor or outdoor, the humidity levels, the temperature, the velocity, and then external temperature involve mechanism or transfer, whether it is a conductive heat, radiant heat, those kind of interesting things you need to discuss tau, Mr. Derick. Boleh ke? Nanti you cuba buat resubmission lah dekat iPads boleh kita buat satu poster je, tak nak besar-besar. Poster tu biar besar dia satu A0, but it's a comprehensive poster talking about these environmental conditions for the extreme temperature. Other than that, I think is satisfactory. Congratulate to Mr. Derick. Go back to Puan Mazdila for the sum up.
Alright, thank you Mr. Aizat. Thank you for the fruitful comment from you, and I hope that Mr. Derick and other students will take note for the further improvement. So any additional said from Mr. Derick before we left for the session?
Nothing.
No?
No.
Alright, any additional from the examiner, Mr. Aizat and juga Puan Azlina?
Just wait for a while lah. After the live ends, please wait for a while.
Ini sebenarnya punya nasihat. Okay, so we end up for this session, and Mr. Derick, you may wait first, and we see you for the next session. Thank you.